And hopefully we'll have more of these in the future. We've been talking about how we can work more closely with our community, and maybe we can sort of promote this in a much better way next time. But there is one final sort of thing that we wanted to just talk about, and that's about a slight restructure in the NHS. And we want to work collaboratively with a number of practices locally, but who better than the actual chair to come and talk to us about this. So I'd like to introduce to everybody Dr Yeats, who works at Priory Medical Centre in Warwick, and he's our chair for our network, and he'll tell us a little bit more about what the network is and what it means to us. Over to you, Nick.
Thank you. I won't keep you long. I've had a nice afternoon, and you've got your champagne, is it? Soon to finish. The network, you'll read and hear a lot about networks in the press increasingly in months to come. As Nilesh says, I'm the clinical director for the Kenilworth and Warwick network, Nick Yates GP, here in Warwick at Priory Medical Centre. Traditionally, general practice has been relatively isolated surgeries working in close proximity but separately. That's going to change. It needs to change. The NHS isn't currently fit to provide healthcare to the level that I think it should do. In 5 years, it definitely won't be. We need to do things differently. We are doing things differently. We can do things differently. It's just about how we do it. So within South Warwickshire, there's a number of different networks. As I said, ours is Kenilworth and Warwick, 5 general practices, population size 60,000. We're the largest network. We're a large network. We are separate general practices, but in coming years you'll see how we work much closer together. So for example, we'll be employing staff together. So we've just recruited 2 clinical pharmacists who patients will see face to face, on the phone. There'll be some back office work that they do to try to improve care we provide to patients. We're in the process of appointing a social prescriber who will help people with the complexities of social need that often go hand in hand with healthcare problems, often the most vulnerable in society. So these are the things we're doing immediately. Beyond that, next April will include physios that we employ, physician's assistants, beyond that community paramedics. So there's lots happening, lots changing. There'll be closer sharing of staff, beyond that integration, and building relationships and looking at innovative ways that we can help patients and help our practices run more smoothly and effectively. A big part of that's going to be patient engagement. We have our patient participation groups, but I think with time, there's strengths in different groups, there's strengths together, so I can see that we would need a network-wide patient, truly representative group that can help us decide as a network how we help patients. We're all patients, all the doctors, all the clinicians, we're no different, and we know that together with patients and with the healthcare professionals within a network we can probably achieve quite a lot. So it's quite exciting, there's a lot to do. You'll have questions, we're finding out things as we go along, and we'll keep you updated as time progresses. Yeah? If people have burning questions, you're very welcome to answer or ask me. I may know the answer, I may not, but I can try. Tim should know all the answers, hopefully.
And for those who aren't aware, that we thank the Cycle Club for their efforts today. They've covered, what was it, 18 miles, did you say? 18 miles. So there are 5 practices in our network. I don't know if you know all the names of the practices locally, but so of course here Chase Meadow, we've got the Priory and Avonside Health Centre in Warwick, and then we've got the 2 Kenilworth practices, Castle and Abbey. So what our lovely friends here have done for us is cycle round to each practice and presented a little plastic plaque like this, a little smart plaque like this, just showing that we are all connected together and we're going to be working together, and just as a representation really. So we're going to find a nice strategic spot for this to go up somewhere in this building, hopefully to show that effort as well. So a big round of applause to you guys as well, of course, for your efforts. And I think that's